Hello, everyone, and welcome to our February webinar. And today is an unusual webinar and a webinar that I'm very excited about. I today have my dear friend and colleague, Deanna Hansen, joining me, and I'm going to give her the opportunity to share with you the remarkable healing system that she developed. Deanna has a unique background in both being trained to be a physical therapist specifically for high-performance athletes, teaching yoga for many years, being a very unique hands-on healer. But really what grabbed me is that when Deanna gave me a treatment as part of our group of leaders in the holistic field in Mexico about a year ago, that I can go spend the whole time just describing what she's able to do. I really saw how she's able to see the pattern that unfolds as different symptoms. And this is a quality that is getting lost not only in Western medicine, but also in so-called integrative and naturopathic medicine. Even in the realm of looking at functional medicine and looking at genetic changes, these are changes. We are interested in movements because we are a body of energy. We are a body of movement. And we picked this time specifically in preparation for the Spring Cleanse webinar that will be late March, may have to move to early April because of how this work can relate to the level of detox. And in principle, when we want to detoxify something, we want to get rid of something that we don't want, right? That's the definition of detoxification, something that is a toxin for us. And these toxins are wise to know where to hide. They're not obvious to the system. If they were obvious, the body would have cleared them, would have gotten rid of them, and there wouldn't be ongoing toxins. So we do it through diet, through cleansing, through herbs, through infrared sauna, through some body work, through enema, through colonics, through IV therapy, through many ways. But there is a part of us that is toxic to us, that is traumatic to us, that we can't deal with, that hides in our body. And it hides in what in esoteric Chinese medicine is called boxes. You can literally feel them in the pulse, like boxes. And these boxes translate themselves into fibrotic tissues, right? In my book, I talk about fibrosis and about mental fibrosis, right? Getting stuck in a pattern. This stuckness happens within our body. And since this area is not alive, it's stuck, it creates adhesions, which means there is not the same amount of flow of oxygen, which means it can be a toxic area that the body lost control of, right? What ultimately can be cancer. Deanna's block therapy system allows you to melt these areas by creating pressure and by working with your breath. Because our circulatory system and the system of releasing of oxygen is built to release oxygen very dramatically when we get to areas of acidosis, of less oxygen. So we are creating this area artificially, and Deanna will give you today an experience of it and explain to you. And then we are working with our mind and with our breath to deliver oxygen to the tissue. And the results are between significant to miraculous on this range. And the nice thing is that they create a movement that then unfolds. And in this sense, I'm so excited to have Deanna today sharing with you this and have her as my guest in my Hawaii Open Heart Medicine retreat, where she will give daily sessions as part of our big day and help in allowing open heart medicine to unfold. So Deanna, welcome to Open Heart Medicine. And we just spent a week together with you and your sister, with Gilly, my partner, wife, and me. And we had a great time. And it's so good to see you again in this video, even if we have about 60, probably to 70 degrees Fahrenheit between us, or 40 degrees Celsius. Our heart is open and warm. So please, the stage is yours.
Thank you so much. That was such a beautiful introduction, and it is so lovely to see you again. I do miss beautiful Hawaii, I have to say. So, the first thing I just want to really share about what we're going to be doing today is there's three pillars to what we're sharing with block therapy. And we're going to be using a rolled up towel when we get to the work. But these pillars, as Isaac shared so eloquently, are really about creating the space in the body that we've lost through time. So we have foundations in the body that are here to support proper cell alignment, and the fascia system is really the system that is designed to do that because of the combination of the proteins that make up the fascia, which is collagen and elastin. When they're in balance, it gives us structure and mobility. But what happens over time from unconscious living, being dominant on one side, is we start falling away from our current or our correct alignment. And as we tip off balance, the collagen component of the fascia starts to migrate to create false walls and false floors. And just like scar tissue created from injury or surgery, these adhesions that develop over time block flow of nutrients into cells uh, as well as stop the ability for the body to detoxify efficiently. So what we're going to be doing today is we're going to be giving you a sampling throughout the body to really understand how to optimize the breath, how to release the adhesions. We're going to work quite a bit in the rib cage because this is key. We really want to be able to fully and consistently breathe diaphragmatically. But what happens over time is as we start collapsing and these adhesions form, we get locked in these negative patterns, and that affects our ability to breathe diaphragmatically. We start breathing through the muscles of the upper chest, and that really limits oxygen absorption as well as the detox. 84% of weight loss they've shared comes through proper exhalation because of the detoxifying components of this beautiful muscle and this cleaning ability. So what we're going to be doing today is really working to open things up. And I would love if I can now share, Isaac. I've got a few before and after photos of people that have been doing block therapy. And you can see in such a short period of time the amazing changes that happen to their body through this 30-minute per day protocol. Okay, so this is Connie. And Connie was our winner of our 90-day program. So first of all, just really take a look at this before photo. You can see how she's very forward held. You can see that, you'll see really from the side what I'm talking about when you see the drastic change in the size of her belly. But most importantly, when I'm looking at a body, I look at the foundation. So when we look at her legs, you can see there's so much adhesion and thickness and bulkiness in the front of the legs, especially in the front of the ankles, which we can't see perfectly here in this photo. But what's happening as we start falling out of alignment over time, because the breath is what drives the blood and oxygen, as well as the detoxification, the extremities become the most frozen and sealed. So the feet and the calves really dictate what's going on in the body throughout the entire body. So when we have a patterning of pulling away from midline, which will have one side acting like a driver, like a flat tire, think of driving a car and the tire's flat, everything gets pulled into that side. The opposite side of the body anchors to stop us from tipping over, and this creates tension within the body. And as we continue these negative patterns throughout our lifetime, these grooves deepen, and that affects the breath, it affects the mind, because everything is tied together. So what's so lovely that we can see here in Connie's after photo is, first of all, how much lift she has in her rib cage. And just take a moment and think of what's inside this container that we have. So we have in the rib cage, of course, there's the heart and the lungs. In the abdomen, there's the liver, the pancreas, all the organs that are in there. And when we're collapsed and twisted, these organs are getting pushed around. They're not getting proper flow either, because when we're breathing diaphragmatically, this plate of muscle that's moving up and down continually creates a mechanical massage to the inside of the body. But pain, fear, and stress cause you to reactively hold the breath. So most people now are breathing through the muscles of the upper chest, which really depletes the amount of oxygen that we're getting into the body, but also we're not getting that mechanical action in this area. So think of when we're eating, part of what digestion is assisted from is that mechanical action. So if we're not breathing and using that muscle properly, then we're putting all of this food into this container, but it's not getting the energy that it needs to properly break down the food and absorb and so on and so on. So I just want to show you from the back the changes that again occurred in 90 days. And we also asked Connie, well, we asked everybody not to change anything else, not to diet, not to change any other exercise routine. So just put this into your life to see what kind of changes can happen. And I just absolutely love her back photo. You can really see how her shoulders have come back and down, how the low back, you can see the lengthening that has occurred in the back, the alignment of her pelvis. All of these things were putting her body back to the right alignment so that everything on the inside can flow properly. Now, this is the best one though, this side photo. So she didn't change her diet. And this is what is so fascinating, is really through shifting how she's standing, how she's using her body, how she's lifting her rib cage, aligning the cells properly, she has now moved so much waste, inflammation, toxins out as a result. So I just love this side photo. And even notice what's going on here in the neck. You can see the front of the neck. Imagine the thyroid in the front of the neck, what it would be like in this before picture compared to the after picture. She has so much more space in the body through here. Also, the armpits. We're going to be getting into some really cool areas in the rib cage with the towel, and the way that the shoulder blades will seal out of alignment, locking us in this pattern, blocks the lymphatic system from properly working in that space. Isaac, you raised your hand. Did you have a question?
Yeah. I want to make a comment. Can you go to the front picture?
Yes.
So I want just to give you an example of other therapies. Okay, so you look at her, and you can see that she's also a little bit of scoliosis, not a lot in the left picture, but you can see how she's completely bulging forward. And what's happening, she's first locking her circulation to her legs, but she's also blocking her pelvis. Okay, and she probably in this position will have lower back pain. So she will go to a chiropractor, will adjust her, and it will work for exactly 2 hours to 48 hours, and then she'll go back. But really, you can see how this posture is affecting not only the digestive system, but when you don't have enough oxygen, there are so many diseases that can happen from this. Prolapse of organs, because, right, like, uterine prolapse, bladder prolapse, rectal prolapse, because she is blocking, right? As you see,
Yeah.
it's a whole structure. And then look at how her shoulders are now positioned in the right place. So what happened is her chest opens up. So also your being in the world changes. It's really an experience when you do like if you do like I really like the initial like 11, the introductory program, and I use the big block, and it's this one, Deanna, and
Yep.
it's remarkable what happens when you finish. It's like first time 20 minutes, and suddenly your chest is just opened, and it gives you a different presence in the world. It's really very, very, very unique, So it's really interesting how it's not only a structural change, it's really the fascia that is pulling us. And often, Deanna, someone can have a trauma and an injury that caused a soft tissue injury, what we'll call, and doctors know, orthopedic surgeons know, everybody knows soft tissue injury is harder to heal than like a fracture in the bone. Why? It's more complex, but more than this, it pulls other tissues, it pulls the bones into a different place, and it changes our structure. So that's what I mean by a pattern, how by working on a certain area, many other areas are changed actually.
And one of the positions that we're going to be sharing is right underneath the left lower rib cage. So there's the heart and then the aorta coming out. And what I tend to see with so many people, because the majority of people are right-handed, is that they compress more into the left side. Now, what's happening to this tube that's supposed to be sending blood to all of the cells in the body, it's getting crunched and twisted, and now the heart has to work harder. So that in itself is such a beautiful shift and change that will happen. And again, you're going to be experiencing that this evening. How about I share another lady? This is Lori, and I love the difference here because Lori is so twisted, where Connie was more forwardly held. Lori, you can see with her left leg here, how this is pulling her whole body out. Now, this was only 30 days. And why I wanted to share these photos is because this was a lower body program. We didn't work the upper body. We really focused waist down for these 30 days. And the amount of change that she had structurally in her legs created that shifting all the way up the chain. And that's why it's so important to recognize where the cause sites are to the issues. Because if we have low back pain and we go and we get the back worked on, as you said, we're not going to get to the result because that's simply the pain site. We need to find the cause sites. And because the feet and the hands are the furthest from the diaphragm, which is the body's furnace or engine, the patterning becomes most held in these spaces. So I just love this example because she's so twisted, you can imagine here we've got, of course, the heart is over here. So here it is. Now there's more space. We have the liver over here. You can see it here. You're going to see in her side photo just the difference in what she would be doing to her liver organ in the befores and afters. I'll get to the back here just so you can get a sense of it. And she has a lot of scoliosis and still a lot of work to do. But again, this was only 30 days. And the legs are also the hardest areas to change because they're the most frozen. So for Lori to have brought her foundation into this balance in that short period of time and seen the changes up the chain was so exciting for all of us and truly remarkable for her. Do you have any comments or questions on Lori so far, Isaac?
No, I just want to make comment because I'm also seeing a little bit of the chat. I get the privilege of watching. It's one thing that Deanna hasn't emphasized when she gets to her work is that each of us control the intensity of the work with the block. So it can be very easy. You can do it on the bed, but in principle, a very important principle in medicine is that if you have a problem in a certain area, don't start working on the area. Work on areas that can affect this area, and often work on areas that are the best areas in your body. Because then these areas are able to absorb more energy. They are able, and then they will assist the other areas. So if you have a certain part, you have intense pain in a certain part in your abdomen or your chest, start working on areas that will affect you, and then slowly move and that's part of the pattern of the unfolding. And what's remarkable here that people may have skipped is that these changes in the upper body are really stemming from changes in the lower body. That's really what the series is about. And people who do Iyengar yoga know that it's so important. It's about really working on your toes, right? You can see somebody who did Iyengar, their toes are always open. And because what happens is you really bring the kidney energy, really brings the earth energy up. And then skipping the back straight is not an effort of the muscles of the back. In fact, the back is supposed to be relaxed. It's the whole energy holding you from your basis, from the basis of your pelvis, from the perineal area. And you could see it very much in the previous person.
Yeah, and I also love noticing how much difference her rotation is. So imagining the upper shoulder trap area through here, the amount of tension that will be carried here because her body is getting twisted so far over to the left. And now these muscles in this area are trying to stop that, trying to hold her up. So now in this after photo, because she's brought her legs into balance, she doesn't have to work to keep that part of her body up. So again, just to share that. Now, the last picture I just wanted to share, this is just such a fun one. This was our 21-day face challenge. And in 21 days, the remarkable changes in the shape of her skull, in the lift of the tissue, the fullness of her face, the balance to her eyes. I was just so excited. And yeah, I just really wanted to share this one because this was 21 days. 21, and it was basically rib cage, neck, and head that we did focus on here. But imagine the brain inside the head and how if this part of the skull has collapsed, how that will affect the brain because now the brain is going to have adhesion and pressure and not that proper blood flow. And then also all of the inflammation and toxins that get stuck in that space. So to be able to create that symmetry in the head and create a change already in the neck to improve that lymphatic drainage is just so exciting, and it's just so evident in this photo here. So So how about we dive in and give this work a try? Are you
Let's do.
ready?
Yeah.
Okay, I'm going to stop sharing and we are going to get started. Okay, so the first thing is we all need a rolled up towel. So I'm just going to show you how to roll it up. Okay, so we have a nice big towel. So I've quartered this towel. So here it's folded in half, and then I'm just folding it one more time. And then I'm just going to roll it up nice and tight. You just want it to be as dense as possible. And it's pretty amazing how effective this rolled up towel is for fascia decompression. Okay, so now the very first thing that we're going to do is we are going to work right on the belly button. Now, the nice thing about the towel is you can take out some of the height if it's too intense for you. And there's only two rules in block therapy. The first one is we want to hold each position for 3 minutes as a minimum. And the second and most important one is your breath is your guide. If anything causes your breath to be strained, that's your body letting you know it's too intense. So you're in full control of what you do and how you do it. So always respect your limits. It never serves us to force the body. So we're going to dive in. So again, we're going to be right on the belly button. And we just want to take our time as we slowly bring our body onto the towel. And to begin with, stay up on the elbows. And if you feel like you need to adjust the height of the towel, do so. And also, unless you can't, breathe in and out through your nose. And for the first minute or so, let's focus on the inhalation phase of the breath. The goal here is that we're breathing through the belly. We want to bring the breath down. Again, most people are breathing through the muscles of the upper chest, and that's a stressed breath. We want to pull it down to the belly so we can bring the air deeply into the lungs. At the base of the lungs is where the majority of the oxygen receptors reside. So by this belly breathing, we are allowing the air to go to that bed of abundance for optimal absorption, as well as detoxification. Now, you might feel some interesting sensations here as well. Pain is okay to feel as long as you're breathing in a relaxed way. So pain, pressure, you may even feel a pulse, the aorta. That's okay as well, as long as you're breathing properly. So just take a few moments and just really get a sense of how this feels. And at any time, if you feel you want to bring the rib cage to the floor, you can certainly do that. And now that you're starting to settle in, let's shift our focus to the exhalation phase of the breath, feeling the towel sink deeply into this core space with that full exhale. And if you can hear yourself breathing, see if you can pull back a bit so it's a little bit more relaxed. And let's now exhale for a count of 6 and inhale for a count of 4. We'll spend one more minute here. And just notice what comes up. Notice what you're thinking of. The wonderful benefit of this is it's also meditative. When you're focused on your breath and connected to pain as a sensation on purpose, it quiets the mind. Also, by focusing on that full exhale, you're turning on the parasympathetic nervous system, which is where we need to be for healing. Let's take 3 more slow, full exhales here. And when you're ready, we're going to place our hands under the shoulders, take a nice inhale, and then when we're going to lift off, let's exhale with the movement. So exhaling up and off. Okay. So before we dive in to the rest of the positions, let's just check in with how we feel when we take our arms up toward the ceiling. Just really get a sense of the range of motion that you might have. You can take the arms back behind you, lift them as high as you can. Notice if you can sense any heaviness, maybe in the ribs. Just get a feel for where you're at right now, and then when we're finished, we'll check back in. So this next position that we're going to do is going to be right on the left lower ribs. So for the ladies, just you can place your hand, it's just below the breast tissue. And getting into this, we just always want to be cautious as we move into position. So I'm going to take my right leg out to the side, and then I'm just very slowly going to lower my body onto the towel. And again, let's just stay up on the elbows at first. We just want to get a sense of the pressure in this space. And then if you can, just gently lower yourself down a little bit further. And now let's connect back into that full exhale. You want to get a sense that the belly is lifting up into the core, lifting off the floor. Now we're right on top of the stomach organ. Again, the aorta is coming through here. And the goal, again, is that we put as much space into this area as possible. And we want to become pain seekers because adhesion is where the pain resides. So when we can follow the path of pain on purpose, then we can very effectively undo what time has done. And the pressure fibers are larger in diameter than the pain fibers. So you'll likely notice as you stay in a position, the pain starts to change and it becomes almost a good pain. And again, if it's too intense, that's your body saying this is too much for you. So from here, if you choose, we can slowly take the upper body to the right. We're not sliding on the block. We are gliding in the layers of fascia. The twisting that we do creates a shearing, and we get to the deeper adhesions that are locking us out of alignment. Keep focused on that full exhale, exhaling for a count of 6, inhaling for 4. And then very slowly migrate the body back to that neutral position. And then you can just take that left hand to the floor and pull yourself over to the left. Nice and gentle. If you want a little more intensity, you can lower the rib cage a little further. Slowly start walking your upper body back to that neutral alignment. And we'll take 3 more slow, full exhales here. And when you're ready, place your hands under your shoulders and slowly exhale up off of the towel. Now let's do another position on that left side. Just notice though how that feels. If you feel any lightness, any lift. But now what we're going to do is the upper side rib position. So it's going to be basically nipple height, but over to the side. And the reason this is so important is because the shoulder blades will lock and grip the ribs with those adhesions from unconscious posture over time. So we want to release that so we have better range of motion for the arm and better lymphatic drainage. So I'm just going to place the towel here. Very slowly, we are going to find our way to that position. And initially, you can support your head with your hand, and you can have your knees bent just so that you're nice and comfortable. And as we're here, let's check in with that breath. You can place that top hand on the belly. You want to feel it become nice and big with that inhale and nice and small. Think of squeezing the belly small with the exhale. And then from here, just gently rock forward and backward, just to get a sense of how this area feels. And now for some of you, this may be more than enough, but I'm going to take you through a little bit of movement here. So respecting your limits, let's place the top hand on the floor. So now we're just leaning forward a little bit. The left hand we're going to take to the top of the mat and use your fingers to walk the arm away. So we're really extending here. And then from here, if you can take this left hand and move it back behind you even further to open up this space. And then we're just going to stay in this space for a moment. For a lot of the ladies, you may feel that breast tissue is getting compressed. That's totally fine, as long as you're breathing in a relaxed way. And just really focus on that beautiful exhale as we surface the toxins from melting these adhesions. The exhale is how we effectively move them out of the body. Let's take 3 more breaths in this alignment. And then slowly walk your way back to that sideline position. And then we can even just place that top foot behind us and then just lean back slightly, just to reach a different area. And then for the last 3 breaths, just go to the area that you felt the most sensation. Nice exhale for a count of 6, inhale for 4. And then when you're ready, just lean into that top hand and slowly and gently exhale up to seated. And again, just notice how this side feels. Let's check in. Let's raise this left arm and notice, and then take that right arm up and notice. And you can even just lift it up a little higher to the ceiling and just feel the restrictions on the side that we haven't worked compared to this left side. So now let's do those same two positions, but on the right side. So we're going to get right on top of the liver now. And we all know how important the liver is for detoxifying the body. So again, just right below the breast tissue, right on these lower ribs. We'll take our time getting in as we first take that left leg out to the side and then slowly lower yourself into position. And initially you can stay up on the elbows. This side may feel completely different than the other. We're on different organs. We're not symmetrical in the body. So let's tap into that full exhale here. So now what's lovely is fatty liver disease is such a factor in a body being healthy or not. And when fats are solid like butter at room temperature, it's going to clog the liver's ability to do its job. So by adding pressure in an area over time, combined with this diaphragm moving up and down, which is basically right in this space as well, the two are very effective at melting these frozen fats in this space. Now, if you want to explore a little bit more, we can take the hands over to the left and gently pull the upper body to the left. Again, we're not sliding on the towel, we're simply gliding in the layers of fascia. Slowly take the upper body back to neutral. And then you can continue pulling the body over to the right. And if you feel you can handle a little bit more compression, you can simply lower the rib cage closer to the floor. Then walk the upper body back to neutral. And we'll take 3 more slow exhales here. And steady, hands under the shoulders, and slowly exhale out of position. And now we will do the upper side rib position. So again, nipple height. Take your time as you get in. You can support your head in your hand. And then use that top hand to feel the breath coming from the belly. And then once you've settled in, just gently rock forward and backward, nice and slow. And this may be as far as you want to go, but if you want to go a little bit deeper, let's lean into this top hand. Take that right hand to the top of the mat, walk the fingers away. And then you can even take that right hand behind you. And see if you can even slow the breath down a little bit more now. It can still be an exhale for a count of 6, inhale for 4, but slow it down. The more we can control the breath, the more we can control our inner world, our emotions. We'll take 3 more breaths in this alignment. And then very slowly, let's walk our way back to the sideline position. And then you can even take that top leg behind you and just to explore in a different space as you lean back slightly. And then for the last 3 breaths, spend time where you felt the most sensation. And when you're ready, very slowly exhale up and out of position. So now we're going to do the ASIS bone. This feels absolutely lovely. So before we start, just you want to locate, find that bone that's going to feel like it's poking out here. And what we're going to do is we're going to lie right on top of that bone on the left side. The leg side will be out to the right. And then we're going to draw the body away. So we want to broaden the pelvis this way. So let's just get your body positioned on top. Right leg out to the side. And then once you've settled in here, use your hands to draw your body to the right. Nice and slow. This is an interesting sensation here. You want almost to get a sense that your fascia is getting peeled from the underside, the inside of the pelvis, as we're pulling it up and out. with that full exhale, feel the belly getting pulled up into the core. You can even take the upper body and twist to the right. And then even come onto the left toes and lift that leg up off the floor, feeling as though you're extending the heel away from the body. You can release the leg. And then slowly take your upper body back to neutral. And then just draw your body a little more to the right for 3 more slow exhales. And then place your hands under your shoulders and exhale out of position. And now we'll do the same thing on the right side. Again, taking your time to get in. And then once in position, draw your body nice and slowly to the left. You can take your hands to the left and twist the upper body. And if you choose, you can come onto the right toes, extend the leg off the floor, lengthen the heel away from the body. Slowly bring the upper body back to neutral. You can release that leg. And then draw the body a little further to the left for the last 3 breaths. And when you're ready, hands under the shoulders. Slowly exhale up and out. And now the last 2 positions, we're going to be getting a bit of a double whammy. So we're going to be having the hands sandwiched between the glute and the towel. So the first thing we'll do is we'll start on the left side, lie on your back, And then we are simply going to place the hand on top of the towel and then slide the towel underneath the left glute. And then just use that right foot to put a little pressure in. And then you can simply roll slightly to the left. And then you can use that right foot just to explore as you rotate to the left and back as you're searching for pain. And if you want to increase this intensity, you can also lift this left leg up. And then you can really slowly just explore with movement. Staying focused on that full exhale. Let's take 3 more slow exhales here. And when you're ready, you can bring that foot down. Just lift the pelvis up and just shift over. So now you're going to have the hand under the right glute. Use this left foot to give you a little leverage. And you can start by straightening that right leg. And just rock left to right as you search. And if you want to get the leg involved with the movement, we'll just spend 1 more minute here. Three final breaths. And then bring that foot back to the ground, just lift up, take the towel away, and then just roll over to one side and slowly exhale back up to seated. And then let's just check in. Let's just see how you feel. Lift those arms up to the ceiling. Just notice if you feel you have any more freedom of movement, a little more length, and also just notice how your nervous system feels. Thank you for joining that demonstration. I'll wait for Isaac to come back out.
I skipped the last two just to be present, to be back again.
Wonderful.
There is nothing like taste, like you describe somebody what is sugar and then they taste it, say, oh, that's sugar or honey. So really, thank you. This was an extensive part, and there are a lot of questions, as you're not surprised, probably.
Yep.
So maybe maybe I'll pick some fews that repeated themselves.
Okay.
And some that that even that really the answer is very quick, and almost like people ask how long you stay in a position. So Deanna's approach is minimal for 3 minutes. That's the time
Yes.
it takes for things to shift, but you work within your pace what you can. But the one question on a medical condition was, can you use it with osteoporosis? That's what. So maybe you can talk about this.
Yes. In fact, pressure will increase osteoblast formation. So again, you want to use your breath as your guide. If you have advanced, then I would stick with the towel for a while till you get really comfortable using this work on your body before going to the blocks. But absolutely, in fact, one of our first teachers, she was 69 years old and started block therapy. And 3 months later, she went and she had her bone density checked and she had a higher bone density.
And again, the idea that when you put pressure, you create a regenerative process because oxygen comes to the tissue. The other question, which is fibromyalgia, which we know the answer, but why don't you explain why it's good for fibromyalgia?
So basically, when we have pain throughout the entire body, it's really an indicator that we're not getting that blood and oxygen flow to those cells, to that tissue. So this work in general, working full body. This was, again, just a little sampling of what we do. We work head to toe. And when we repattern the entire body and we open these channels for blood and oxygen to get to the tissue, then healing happens. And so we're addressing, again, not only the pain sites, but the cause sites so that we can really pull the cells back. Pain is really the cell giving you information. It's not our enemy, it's actually an annoying friend. And if we look at pain as that way and we have a pathway to move into it on purpose, we actually pull up the deeper pain so that we can release it as we're melting through those adhesions and stimulating that flow into the body.
Great, thank you. And maybe on one condition also, and then I want to ask you some question about, because people had some general question about the whole system. What about people with umbilical hernia? And I want to maybe to rephrase it, because some people have very small umbilical hernias that are really a certain weakness in the area that can actually be overcome.
Yeah. So
And some people have more significant. So maybe you can talk about how to position the block and if it's an issue to do it if you have umbilical hernia.
So if it's uncomfortable to lie on the towel or block, what we'll have people do is first start lying on your back and simply place the tool on the belly and then add a little pressure with your hands so you get that sense. But what's really important with this is it's coming largely from this collapse. So as the rib cage and everything above collapses into the core space, it creates this ballooning of tissue outward. And that's going to really be largely responsible for that umbilical hernia or a hiatal hernia. So either way, one of the best things that we can do are the upper side rib positions, because the way the shoulder blades lock us into this holding pattern when we're sitting this way and we've got this alignment and we have all this pressure and stress happening through here, we want to lift the rib cage so that the abdomen can start softening and then over time, as it feels comfortable, we can start moving more deeply with the pressure into the belly. And you'll get a sense of when that is, because again, your breath is your guide. So if it doesn't feel right off the hop, then, and we do share this in our starter program, to lie on the back and to position the block on the belly and use the hands to add pressure for the moment.
Great. So maybe kind of for the people who asked, there are multiple ways of using block therapy. From people who are very sensitive, you use it on your bed. So it's soft. And really, Deanna's one of her main statement is you should feel no pain and no discomfort except the area that you're working on. And even there, you can control it by putting pillows and blanket. Make it comfortable. It's not a torture. And work with your breath. If your breath is flowing over time because of the structure of the nervous system, moving from the initial thin nerve fibers to the pressure fibers takes a longer time, but then the pain becomes different. It's not as sharp, it's more disseminating, and it's more becomes a pleasant sensation. So that's a normal approach, like I was doing today with the big block, because we had guests. I gave them the big block and I did the small, which is too small, and I thought, oh my God, is something wrong? I'm just not producing the same pains. I don't have the pains I have. So it does get better over time, but people also ask how long to do it. And so really, to understand Deanna's program, if you go to her website, it's kind of overwhelming. There are hundreds and hundreds of classes that are built into different areas in the body, different health topics. Deanna, correct me if I'm wrong, that's my observation, and different intensity, from the classical 20, 25 minutes, today you got more, to 2, 3 hours that you can do. So really, it's more intense, each one in their own rhythm. And so really, it's you cater your own menu. And there is something for me, like, because you would think when you use a block, and there's something about the wood, and there's a nice story, Diana, that you share, that you actually make it from trees that will go to waste otherwise in your area. So this is
Yeah,
really,
they're made from reclaimed elm here from in Winnipeg. Dutch elm disease is rampant here, but the disease is in the bark. The wood is beautiful. So they used to chip and throw these trees away. Now we are using them and repurposing them for healing. And bone and wood are similar in density, which is important because the way that the fascia will grip and adhere to bone with a 2,000 pound per square inch magnetic seal, that's what we're dealing with when we're trying to sit up straight. Most people can sit up straight for a moment, but you're very quickly going to get pulled back into these patterns because of the magnetics. So the concept of pressure over time with that slow shearing and the breath, it helps us open up those deeper layers of adhesion so we can get to the root of the issue at the bone.
yeah, and there is something about, about the energy of the wood, and especially that it's local. You actually making it. It is like your energy and your intention. For me at least, it means a lot. So we cherish it. We always keep it in the nice bag, and we have full sets of the 3 sizes everywhere. Here, and when we're in California, and I travel with it. But Deanna, maybe you can explain a little bit about the whole program. And because until you do it, you really don't really get the power of it. And it can be used, people who have multiple questions about multiple illnesses, like if you have an active cancer, that's a different story on the side. But and even then, I'm not saying not to do necessarily, but you have to be more careful. But we tend to identify with labels. I have, people ask, I have ulcerative colitis, I have this condition, I have that condition. And the most classical condition is multiple chemical sensitivity. Because the fact that you are concerned about multiple chemical sensitivity and you're hyper vigilant, and you're already worrying that it will do something wrong, that's the source of the illness. The mind is producing a hyper vigilance, a hyper immune response. Then, of course, you'll be sensitive to chemicals. Most people will not. So we have to be open to the possibility that things can function different. That's the basis of open heart medicine. When we are locked in a pattern, it's called an adhesion, we are stuck. That's like the end result physical expression. That's why I wanted to bring it in and share it, because it flows within all my approach to health and healing. So in this sense, it's incredible that you're offering basic initial program for free so people can taste it. But for people who are wondering what to do and how, you have an incredible menu. I mean, more dishes than in a big Indian restaurant in India. When it's like 50 pages and you get dizzy. So in any case, it's really, there's a lot of options, and maybe you can a little bit highlight how
How
you
it
use
flows.
it and how you shift and what's the purpose of the big block and the baby block and the facial block or small area block, so
Yes. So
understand the refinement.
we love everybody to start with our starter program. Now we do have a sample program. We're not quite ready for that one yet, Isaac. We're getting to our wait list for the paddle, so
Oh,
that's coming
sorry,
in the
okay,
next
I never showed you.
month or two. You're teasing people with something they can't order from the menu
Oh,
right now.
sorry.
But okay, so we've got the two size blocks, and you can get one or the other or both. Now, if you're over 5 feet tall, this is the block buddy. This is the one you want. If you're under 5 feet tall, I recommend getting the baby, but both are beautiful because, for example, there's going to be some positions that the smaller one might feel more intense, but in lots of positions, the smaller one will fit better depending on your size and shape and just how we're all structurally put together. So initially, we start with our starter program and we make it really simple. So in the starter program, we have 9 classes. The first 3 are 7 positions, so about 25 to 30 minutes. The next 3 are 45 minutes. There's 11 positions, and then the last 3 are 15 positions each, and they're an hour. Each class also comes with an additional video teaching you a corrective exercise to really own the space that we've now created. And you can stay in those first 3 basic classes for as long as you feel you need to. The work can be done on the bed, it can be done on a floor. Some people get through a class a day. Some people even get through more than one class a day. Everybody's different in how their body feels they can move forward. So you go through that starter program at your own time. You have it forever. And some people simply stay there, and that's more than enough. Other people want more. And then we have a membership, and that's where, Isaac, you're talking about all these different things that we have to offer. We have a 90-day trauma program, a 21-day concussion protocol, where we're actually getting into the eyes as well as the rest of the body so that we can decompress the patterning that the eyes pull us into. We have a lower body program, an upper, I mean, there's just multiple programs, but there's also additional things in there. There's guided meditations. There's lots of really cool things that we've put together. But what's lovely about them is the guided programs, we take you through it so you don't have to think about it. I've got a 30-day posture reset that's a full body program, and we guide you 30-minute class with an alignment training, a 30-minute class with an alignment training. So we make it really, really simple. But most importantly, when we're starting, we really want to focus foundation. So I want to share one other technique, and this is lovely for people that are maybe tentative to start this kind of work because of a dis-ease in their body that they're afraid of, and that's working between the toes. And I'm just going to show you how to do it right now. We have lots of free videos on our YouTube channel sharing this, but the toes and longevity are connected. Our toes are the furthest from our engine. How the toes are patterned is going to truly pattern everything up the chain. So to sit and simply put a finger or a pencil between each toe and hold for 3 minutes if you have that kind of time, to the point where you're feeling it's painful. But this in itself has changed so many people's lives. We simply share people to work between the toes as well as the fingers. And the fingers are easy because you can do both at once, where you're simply pushing in, holding. You want to feel a little bit of that pain. And you do this, and you can do this every day. And if we only change the toes and the fingers, I always say that the limbs are the puppet masters of the core. Even somebody with a scoliosis, it's the limbs that are dictating that. It's not what's happening here. This is the response to what the limbs are doing. So by repatterning the toes and the fingers, that in itself is going to create better stability for your feet. You're going to learn how to use your toes better when you're walking and standing, which is going to improve balance. And then by releasing the fingers, anatomical position is actually with your palms forward, but pretty much anybody and everybody is walking around with internal rotation and the palms are facing behind them. So to release that patterning in the fingers allows the arms to hang in a more relaxed way, which takes pressure off of the upper back, the neck, even the jaw. It also helps to align the rib cage. So those are a couple of things that no matter what you're dealing with, you can simply start doing that right away. And you're going to start to see and feel some changes pretty quickly if you do it on a daily basis. So that and the breath, and even if you're just lying on your back and starting with that breath work, that's going to, again, it's going to start to change your whole energetics and your fascia system.
Deanna, there are questions about hypermobile joints and connective tissue and Ehlers-Danlos, formal diseases that has it. How do you work with the blocks with people who have hypermobile joints and connective tissue issues?
That's a great question. And actually, just recently, I shared 2 YouTube videos with 2 of our instructors that have that and that have used this to manage and greatly improve their situation. So with hypermobility, there's also going to be hyper restriction. Everything is a balance. So if we have a breath that is so tied, we're not getting any life into the limbs, and then the ligaments in the limbs aren't structurally sound, which creates this hypermobility. So when we start changing that game, opening the breath, changing the rib cage, and releasing the adhesions. The adhesions, as much as people sometimes think the scar tissue is what's holding things in place, that's not the right way to approach the body, because that's a false wall or false floor. We want to bring integrity into our muscle system. So first of all, getting the breath understood and getting the breath going, and then working through the entire body. And then on top of that, those corrective exercises. We teach people primarily, at least in the beginning stages, to do isometric work. And that's very powerful to help heal the body. And because you're not going through motion with a kind of a weight, for example, you're holding and you're breathing. And what's happening is we're bringing more life, more integration of the surrounding cells that have been blocked from use into use. So what's lovely is we have a community group with, like, again, about 18,000 people there. And there's a lot of people in there with hypermobility that also tie block therapy with eccentrics or other types of exercise to get full benefit. So that's what I really love too, is because that group, if you ask questions in that group, you're going to have people that are also experiencing something similar to you that will be sharing their input and their feedback, and also give some suggestions along the way.
Great. And by the way, we are focusing on the question from the Q&A because there are like hundreds in the chat. And so I just going back to the Q&A, and let me see if there's anything. So people are asking again about adjustments if they have limitations. And so can you mention a little bit more about working in a chair or explain how you can work again with you lying down on your back, which pretty much is very, very gentle.
Yeah, so actually in our starter program, what you also get is a 2-hour full seated chair class. So this is lovely because, first of all, if you can't get up and down from the floor, this is a great approach. But also, for example, if you have issue with mobility with raising your shoulder, to be able to access this work with very limited movement of the shoulder, and then you're leaning into your leg, and you're able to melt these adhesions through here, which is going to improve mobility. So the chair work is a wonderful place to start for people if they do have any issues getting up and down from the floor. And in some instances, some of the positions, because we're approaching, for example, the rib cage from a different alignment, that can even get deeper, but there's also greater control on your part because you're not lying on it, you're sitting and you're leaning in. So in many ways, it's a much kinder approach, but it's also very profound in how deep it gets into the whole body. And that's part of our starter program that everybody gets as well.
Again, I want to emphasize it's really good for rigidity, plantar fasciitis. When the legs are locked, it's remarkable. It's probably one of the most dramatic changes because you literally, it's like, wow, it's really, and then your whole structure changes. There were a lot of questions about sciatica, and actually it's remarkable for sciatica, this work, truly remarkable. But you really have to find your specific sequence, you want to see, and then work with it and see which areas. Often the sciatica is is an expression of a problem in another area. So Deanna, can you a little bit talk about sciatic pain, because it's such a big issue for so many
Yes,
people?
I'm just going to stand up and just talk about the patterning a little bit. So whenever I look at a body, there's always going to be one foot that's going to be drawing away from the body, and that's the driver or the flat tire. And then the opposite side anchors. Imagine walking a dog that's 120 pounds that's yanking on you. This is like a slow moving version of that. So this opposite side is often where we end up with that sciatic pain, and it's coming from that opposite side. So to repattern the body and to bring everything back to balance is the key. And so what's lovely, nice timing, is in March, our next series that we're actually adding into our membership is for sciatic pain and more. And it's teaching us how to pull the body into the opposite direction of rotation from where we're always falling into, because that's really the issue. The opposite side, whether it's shoulder pain, low back pain, sciatic pain, it's going to be driven by that side that's drawing us away from the body, because that's that anchoring to protect us. But that protection creates those adhesions, which again, stress everything, because fascia innervates every single cell in the body. And what's lovely too, that last position that we even just did, we're getting into that sciatic area, but when we're doing it with the block, and we show a bunch of different ways that we can get right on top of that sciatic nerve, it's so lovely, because as a therapist, when I was learning initially, and you're trying to massage through the glutes to get to the piriformis to affect the sciatic nerve, there's a lot of thick, heavy muscle to work through. But when you're simply lying on your back and you have this beautiful piece of wood sinking through those layers, very effective at melting those adhesions. But that's working that actual pain site. So we have a whole 30-day lower body program that's fantastic for this. And then we're always adding in more and more. Every month we add in more work, so that people can continue to explore this in a multitude of directions and ways.
Incredible. And can people still use a massage therapy or foam rolling in the same time, or is it any contraindication? Also, from my perspective, once you do the block therapy, I don't think people will stay on the foam rolling. It's also like people asked about the melt system. There's something very deep about this block therapy that is different than other methods. That's why I really wanted Deanna to come and share it with my community, with our
And
community.
this is a complement to everything. So it can be used in conjunction with all of that. The difference between this and rolling is, when you're foam rolling, first of all, the foam roller, what it's made of, it's more porous. And because we want to work through the densities to the bone, we want something similar in density to bone to be able to do that. Plus, when you're rolling, it's like you're taking a boat on the ocean. We want a deep sea dive, because we want to work through the layers. So that pressure over time with that shearing action is what creates the depth of this work. That combined with directing the breath, so that now we've opened up the space, and through that breath, we're pumping that blood and oxygen into that space. So, but yes, this is anything.
Yeah,
This
and I
can be a
think
complement with.
people asking about, can I use a yoga block? You can use whatever you want to use, but you hold the wood. Like I mean, I'm holding it, you know, you feel the energy, okay? You feel the solidity, you feel the energy. I mean, don't want to pick too out there, but you feel the healing power of the wood. I mean, I literally can feel it, the sensation of warmth that comes into it and from it. You don't get it when you use some kind of foam that is synthetically made, This
I
power,
would recommend more the rolled up towel to a plastic or
right,
foam
much
block.
more,
You're going to get
right,
denser, you're going to get deeper
right,
with the towel.
right. So there is something about the block, and that is no, no. At least Diana is like a friend. Like, even you worked on me a lot, and it was amazing. But something when I work on the block, it's like, for me, I feel like I totally like go with it, and I move with it, and it's like it becomes like a friend, that you work on, and then you continue to go back. There's something about it, especially when it's even the baby one is still long enough, and you go into it. So anyway, for me at
Well,
least.
and the nice thing too is when you're doing it as a self-nourishment system, as opposed to going for a treatment, you're following your path of pain, because that's what we're instructed to do. And we're teaching you that pain is your friend, it's not the enemy. And we're not adding pain to the body. We're making you aware of the pain that's deeper than what you're consciously aware of. So as you tap into that and you start to seek for it yourself, that's the beauty of this self-care system, where if I'm working on you, I'm going to be following my hands and what I'm feeling, but to have you have that opportunity to guide in your own body, that's the gift, truly.
Great. And then Laurie had a really good question. How does or how can this help with synovial chondromatosis, calcification of the connective tissue? And again, before Deanna answered, calcification is a solidification of something that got stuck. Calcification doesn't happen if there is good flow of oxygen and everything is flowing. So this, Deanna will have the answer, but intuitively, it's probably remarkable for these kind of conditions. But Deanna, please.
Yeah, and I mean, like if it's anything in the body that becomes hard, whether it's a bunion, whether it's a heel spur, spurs on the spine, really that's it is that. It's these proteins that were sent because there was stress in the area. So through the inflammation, the body's always sending what it needs to rebuild. But if we don't support that rebuilding properly, it continues. And then whether it's calcification or just an accumulation of the collagen of adhesion, which will be that way, we see people melt their bunions all the time. You know, if you go to the surgeon, they're going to cut it off, but we melt. So wherever there is that calcification in the body through the heating process and the melting, there's a shifting and a change of what's happening.
And calcification is everywhere. It can be in a joint, and it can unfortunately be in an artery in the
Yeah.
heart. You know, it's a little bit of the same stuckness and lack of flow and hyperviscosity and inflammation. And there was a question here: if I'm dealing with shoulder impingement pain and decreased pain, can I go from the towel to the loud block, or do you recommend the baby block also? I know, or is it just for short people? I'm 5'7", so Barclays, by the way.
If you're 5'7", I would still go with this one, with the larger one, because again, we get to use all the parts. So whether we're using the side, the corners, like in all of the different classes, we're using it in so many different beautiful ways. And also in our membership, I have a number of double blocking classes where we're using both, which is lovely because we can affect more than one area at a time. Sometimes I prefer using both. Sometimes I prefer using one. I find the one creates more of a meditative effect because you're really targeting one area, where when you're using both, you can approach the body from a different way. So we have a number of classes for that as well. But if you're 5'7", I would be getting the bigger one. Yeah.
Yeah. And again, it's also a question of budget. I mean, if the budget is limited, it gets a big one. Each of them have a different use. There are areas where the smaller one will be much more intense, and areas that is vice versa. You know, like if you want to go sometime in your axillary area, then the small one,
Yeah, you can even just
it fits
hold,
better.
and
You know? Yeah.
that's just a lovely way to, even if you've got shoulder impingement, just to create a little bit of space to move that shoulder out. There's a lot of people that have had strokes and such, that they're so internally rotated and so frozen, and to be able to just pop it in here and then hang on to that, you're drawing everything out in a way. So there's a multitude of ways of using this. And that's the thing, like this becomes a lifestyle. So when we approach it that way, we start with the program and it's simple. And then as you become really familiar with how this feels in your body, you start exploring, and you just, it opens up a world for you, and it's there. So, and again, you have these for life, as well as the starter program with that lovely 2-hour chair class as well. So yes.
Maybe last question. There's some question about the feet. Does block therapy help with Morton's neuroma, and how do you address neuropathy of the foot, which is some similarity, not exactly. Yeah.
Well, so for the Morton's neuroma, working between the toes, that's going to be one of your best things to do. And after you've worked between the toes, 3 minutes each toe, then what I would do is I would stand on the floor, grip the toes into the floor, and take 10 breaths. Think that you've got flat tires, and we want to pump up the tires, and we do that with the breath. When we're breathing, think of a fully blown up balloon. That's what we want the cell, is to be buoyant and round and glowing, where when you take the air out, then it becomes wrinkled and compressed and dense, and it falls to the ground. So we want our cells to be full and buoyant. So that's the combination of the breath with the releasing. So neuropathy or neuroma, I would start with the toes. This whole program and system is going to work to support improving flow, nerve flow as well, because we're going to be working full body all the way down and through the legs again. Like this was a tiny little sampling, But starting with the toe work itself, my guy, as actually just the other day, he was sharing, he sits on a hard bench all day, and he was sharing that when he sits, his IT band on his left leg would continue to get numb. And of course, people closest to you don't often listen. But he said that he was reading up on it and he found that it would be coming from the groin. And I said, it's coming from your foot. I mean, I can see how he walks. So I grabbed his foot. I spent, a couple of hours working on his legs and his feet, and the numbness is gone. So
I hope this was useful. Thank you, Deanna. I'm so happy we made it happen.
thank you so much. It's been a joy.
Okay.